Daily bone health habit you wish more people in their 20s and 40s they should adopt before it's too late?
Indian population, they are deficient in D3 and B12. I would start them on vitamins straight away.
Something very exciting I know about your test, which is called the Shetty Test.
You won't believe this. What we found out was we were saving 40 minutes on each patient. We were saving about 1,000 rupees on each patient, and we were saving them from radiation.
You said you came from a Kannada medium, so back down in Udupi to the journey here. What is that journey about?
I was born in a family where there was nothing. My mother never went to a school. So then the most important and most major event in my life I did was I took my mummy to England.
Pant had a serious accident. Now he's back into playing. 20 years back, this would have been a very difficult phase for him to come back. So there's a lot of improvement which has happened.
Depends on each individual. Some people heal faster, and in some people the healing process is very, very slow. He has made a very good progress.
Today's generation also is very Google.
They do chat GPT, come with a diagnosis.
What do you have to say about that?
I get patients with 50, 60 pages of documents coming with information on their condition and expecting me to read. This is happening on a daily basis. So it's a wrong thing.
You introduced PRP in India in 2009.
One of the IPL players was brought to me, bowler, and he was specifically sent to me for PRP because we brought it up. I did PRP injection here in Hirandani Hospital. Then I spoke to the physiotherapist 3 months later. He said he's back in the game. He's been taken by Gujarat Titans.
So with more people hitting gyms, what are the top 2 or 3 injuries we are seeing nowadays?
There are some people who are doing too much of this consumption of high protein. They are bound to have this uric acid problem, and uric acid can affect the
Namaskaram. Welcome to another powerful episode of Who's on Air. I'm your host Kamlksh Shetty, and get ready to rethink everything you know about bones, joints, and aging gracefully. We're joined by one of India's most respected orthopedic surgeon, a pioneer in cutting-edge recovery methods, and the man who introduced PRP therapy to India back in 2009, Dr. Vijay Shetty. From bone health in your 30s to sports injuries, robotic surgeries, and even a diagnostic test that works without radiation. This is not just a medical conversation, it's a wake-up call for anyone who moves, walks, runs, or simply wants to age with strength and grace. So here we go to have a wonderful session with Dr. Vijay Shetty. Namaskar, Doctor.
Namaskar.
We often think osteoporosis is post-60s, but with lifestyle changes and nutrition gaps, is the bone clock ticking earlier in the present time? What do you say, doctor?
No, I think the concept of osteoporosis is becoming more popular now.
Okay.
Because I think about 25, 30 years ago, women mostly unfairly get affected by osteoporosis. And when there is a problem, when they would go to a doctor, and then osteoporosis would get detected.
Okay.
Otherwise, it's a condition most people ignore. And only when there is a problem. Problem is most of the time a fracture.
Okay.
And that is when they end up in the hospital, and then the osteoporosis gets detected. But of late, I mean, because of the massive over-information over the internet, people are becoming more and more aware of osteoporosis. And it's quite interesting that ladies, especially in their 20s, 30s, come and get themselves checked. And that is why osteoporosis gets detected very early, and it gets treated as well. Okay. And also when it comes to treatment, again 25 years ago there was hardly any option. You would give them a tablet also. But of late, in the last 15, 20 years, we've had so much advance in the treatment of osteoporosis that there are a number of injections available, and there are so many other treatments. And in fact, I believe now that it can be reversed.
Is it?
Yes.
Okay.
It can be reversed with modern treatment. And, thanks for asking that question. 60 years, no, it's not. That is a general belief that people think once I cross 60, men or women, that I might get osteoporosis. No, it may be there in your 20s, 30s as well.
And how do you detect that?
We should be looking for a warning sign. We call that warning sign in medicine. What that means is a healthy person, otherwise healthy, no problem, no other comorbidities, suddenly getting pain in the joints and bones. And unless there's another indication, we should actually check vitamins and osteoporosis. These are two conditions which affect 90% of that patient population.
Okay.
So when you know there is a warning sign, the first thing that we orthopedic surgeons do is that we check vitamin D3 and B12 levels, and also there's a test for osteoporosis which is called bone mineral density.
Okay.
And I think it's worth doing it, and you won't believe it. I have seen women in 30s having severe osteoporosis.
Is it?
And you start treating them, they become completely okay.
So is it a lifestyle disease as of?
To some extent, yes, because of misuse, like you said. But also it can be because of various factors like hormonal imbalance in ladies especially.
Okay.
And in men also it can be a problem, especially if you're not that active in life. And it's very uncommon in people who have been very, very active, like sportsmen. It's very uncommon. But if you have a person who's doing white-collar job and not much activity, then he can also get osteoporosis at early age.
So you recommend
40s.
people have to be physically active also?
Physical activity is the mainstay of treatment.
Okay. So doctor, what I understand is there are more women who get osteoporosis compared to men. Can you elaborate on what you said?
The ratio is roughly 1:5.
Oh.
So if you see one osteoporotic man, in the same group there will be 5 osteoporotic women.
Okay.
Which simply means unfairly and unfortunately it's very, very common in ladies.
So what's a daily bone health habit you wish more people in their 20s and 40s, they should adopt before it's too late? There should be some habits which they need to get into.
Yeah, it's quite difficult. I think by the time these patients go to a doctor, they're quite bad.
Okay.
In the Western world, there are regular screenings. For example, I spent 10 years in the UK, and every 3 months, 4 months, the GPs send, reminders to patients to come and get themselves screened. That doesn't happen in our country. In our country, what happens is when there is pain, you go to the doctor. The regular screening doesn't happen. So if you have that regular screening system, you will pick up those patients who are, who might get osteoporosis in the future.
Okay.
So and then you can take prophylactic measures.
Okay. So what you recommend and tell people that you should always keep a watch on certain telltale signs and make sure that you go visit and probably do a basic checkup.
Basic checkup.
And how often should be that be done?
See, for osteoporosis, the recommendation is once in a year if you're over 40.
From your regular checkup, this can be one of the things. Which
Once
people,
in a
I don't think that's not a tick mark with them. They don't do that.
They don't do that. That is one thing. And the second biggest challenge is vitamin deficiency. Now, as I mentioned, when I was graduating as a surgeon, and nobody used to talk about vitamins, but in the late 90s and 2000s, this became very, very, popular among the doctors that deficiency is a common problem now. Now, when it comes to Indian population, this has been researched very well. 9 out of 10 are deficient at any given point. 90% of the vitamin D and B12. 90% of the population, they are deficient in D3 and B12, and this has been well researched. There was a publication even in Times some years ago, and so now when we have someone who comes to us who is otherwise looking healthy and says I get pain here and there, the first thing that I would do is I would start them on vitamins straight away.
Okay.
There was a time I used to do vitamin tests, but now I know 90% of the population is deficient. I give them the first 3 months dose. So even if their levels are normal, these 3 months dose are not going to kill anybody. So it will at least correct the vitamins without doing a test.
That's something we all need to probably look into. And
yes.
As a common man, I know that vitamin D you get from the sun.
Correct.
We're not going enough outdoor nowadays. So there are recommended other tablets because vitamin D also has the news says this is not so good if you take in heavy doses and all
Correct.
that. So going to a doctor makes a lot more sense to understand what is your need
Yes.
as a person, right?
Yeah. So people are becoming more and more aware of this problem now. And it's interesting, in a clinical setup, you will sometimes see people have done their tests and come to the doctor
Okay. So
on their own.
it might be a certain segment, a certain percentage who do that. And the awareness has to grow a little more, right?
That's correct.
Before it gets into something really serious.
Yes.
Going back to your 10 years stint in England,
Yes.
I'll go back with you to your past a little bit till your journey where it began also.
Yeah.
So what was being in the UK like and what did you do exactly, doctor?
So post my master's in orthopedics, I applied for a fellowship and applied for a job.
Okay.
I was fortunate. I got a job and I didn't have to do the English test.
Okay.
That is again another interesting thing because that was a time when IELTS was just introduced. So what that meant was if you have to go to the UK, you have to pass that English test.
Okay.
And I'm from a Kannada medium. So
Okay.
I was very friendly with the professor in Oxford.
Okay.
He had come to Mumbai for a lecture and I did a small lecture and he was impressed.
Acha.
He asked me, would you like to come to Oxford?
Oh.
That's where it started.
Okay.
So I started writing to him and I used to follow the same English, the language that he used to write to me.
Okay.
He was thoroughly impressed and he wrote to the GMC, General Medical Council in the UK, which gives you registration for practicing, that I don't need this boy to give the exam. He can come straight away.
Wow.
That's how it started. So then I spent my initial few months in Oxford, one of the most famous orthopedic centers in the world, Nuffield Orthopedic Center. Then I had to look for a job because I didn't have the money. So I had to look for a different job. So throughout my career, I was working as a staff surgeon, orthopedic surgeon. But final 1 year, I did a very popular fellowship in Cambridge in hip and knee surgery.
Okay.
And I worked with one of the most popular and arguably wealthiest orthopedic surgeons in the country, Mr. Richard Wheeler. So I did my final fellowship with him, and before leaving, I was working at the Wellington Hospital in London, which is even now the biggest private setup in the UK, and it's near Lord's Cricket Ground.
Till date. And
date.
you have, what is the story of the sports journey which you had?
Oh, sports journey. This happened after I came back.
Okay.
I was interested. I was always, in sports surgery, arthroscopy is the main surgery. And I was trained with it. And I started here. And then I was approached by the Indian Association of Sports Medicine for a lecture
Okay.
in Amritsar.
Okay.
This was many years ago. And the gentleman who actually conducted that conference invited me to become a committee member of Indian Association of Sports Medicine. And then they requested me that I should be doing a sports medicine conference, which I did in Westin in 2015.
Okay.
In the year 2015, I had called some of the big names in sports medicine. That's where my journey started. And then they made me vice president of Indian Association of Sports Medicine. I was in the position for 2 years. And by default, vice presidents ultimately become presidents. But there were 3 vice presidents.
Okay.
So the panel picks up one person.
Okay.
So last year, I was appointed as the president of Indian Association of Sports Medicine.
That's so nice. You said you came from a Kannada medium.
Yes.
So back down in Udupi
Yeah.
to the journey here right now, you are loved and liked by so many people for the kind of work you're doing. So what is that journey about?
Thank you. Thank you for asking that question. But this is a very maybe dull story, but
No, I'd love to hear it.
I was born in a family where there was nothing.
Okay.
My mother never went to a school.
Okay.
Okay, I'll start. No problem.
Etc.
Never went to a school. She was completely uneducated. And because I was very naughty, there used to be a teacher around the village, used to walk by, and she told him that this boy is naughty. Please get him admitted into a school. You know? So for that reason, and I didn't even have a proper date of birth. So they had to put, those days, okay, 1st July, because first, and made me eligible for admission in the school. And that was a Kannada medium school. I was topping and I was doing very well, but there was nothing at home. We used to have a problem eating those days, and mother uneducated. So but I knew I was getting good scores in the school. By the time I was 5th, I was actually first every year. My teacher asked me, because those days, teachers, what would you like to become? You would have heard about a movie called Nagarhule, Kannada movie. Vishnuvardhan was the actor. And they took us all to the movie. And we came back. Then they made me sit in the first row because I was very short. And the teacher asked me, what do you want to become? I said, I want to become a doctor. Then she said, which doctor? I said, surgeon.
Acha.
Then she said, which surgeon? Then I didn't know because I was too small. So then, I just passed 10th with good score. I got 11th by scholarship in PPC. And 12th, I passed the first entrance exam.
Okay.
In Karnataka. Ramakrishna Hegde was the chief minister then, and he introduced common entrance test. That was the first entrance test for medicine and engineering in Bangalore, in Karnataka state. And I think that changed my life because I got a seat, a merit seat. But then there was no money, so we had to go for loans and so many things. Finally, I finished medicine. I got into post-graduation, and then I went to England within a year. And I was struggling to communicate because I was from Kannada medium. Even MBBS, I got first 6 months, I couldn't understand anything, but first year itself, I got a first class. So then the most important and most major event in my life I did was I took my mummy to England.
Wow.
So I remember going to the British Embassy with her passport and thumb impression. They asked me, what are you doing in England? Because she couldn't stand in the queue. It was like 5 o'clock. You remember those days?
Yes,
you have to go 5 in the morning and stand in the queue. So I said, my parents are old. I took the back entrance. The security guard was very good. He took me in. And then, because there was a big queue, the chief, the embassy chief, he said, you come in. So I went there. And then I said, I want to take her. He said, what are you doing? I said, I'm a surgeon, orthopedic surgeon. It was just, I think, 18 months after I reached England, so my second visit. Then, he saw my mummy. She couldn't communicate. Then he said, she's thumb impression? I said, yes. I said, she's never gone to the school. He said, please go. He didn't ask anything. He said, your visa is granted, Then she stayed with me for 6 months.
Lovely. You are an inspiration. I mean, this will touch so many people's lives, what you said, because this is needed, doctor. For you come from a certain background, you struggled and you reached here. You are one of the respected surgeons today in this industry. I don't know, this is such a beautiful story.
Thank you.
So doctor, you take this as your biggest achievement, to take your parents down to England, show them a life from where you began. Wow. You have worked, doctor, with extensively with degenerative joint tissues. How do you help patients differentiate between normal aging pain and what is the red flag which you know?
So see, the word degeneration simply means aging.
Okay.
Okay, we all degenerate. All of us. Whoever is born into this world will degenerate. And when it comes to the bones and joints, we use the word degenerate for joints. Okay, because joints degenerate, bones don't. So when I say joint, it's usually a joint formed by at least a minimum of 2 bones. They have a surface where there is a joint. That surface is called cartilage.
Okay.
In reality, when you see that cartilage, it is like a ceramic surface.
Okay.
It's that smooth.
Okay.
That is a good joint. A degenerate joint means that surface becomes rough. Simply means it becomes rough. Now, because of normal aging, we can degenerate. Because of some other causes, there are 100 different types of osteoarthritis. Now, the commonest is degenerative, where we age, and in some families it's faster, in some families it's slow. The progression I'm talking about. But the other form of degeneration, that can happen in young age.
Okay.
So the answer to your question is, if it has to be a degenerative disease, then it's a primary, we call that primary osteoarthritis, where the joint surfaces become rough, they become painful, they become deformed.
The
and
shape changes.
Shape changes. So in terms of severity, there are four, in simple terms, four different stages. Stage 1 and stage 4. Simply, stage 1 is mild, stage 4 is severe. And when we talk about treatment of any joint for that matter, stage 1 and 2 and sometimes 3 is usually conservative. We treat them with medications, exercises, supplements, and so many other things. Stage 4, when it becomes, because this is not a life-threatening thing. Okay, so this is a problem which affects your lifestyle.
Okay.
So in stage 4, some people may require surgery.
Okay. So it can be any joint in the body?
It can be any joint in the body, but the commonest being knee joint in our country.
Okay.
When I was in England, we used to see a lot of hip joint arthritis. But here for various reasons, I think maybe some religious practices, because most of us sit cross-legged and all that. I think
That's
that is one of the reasons why we get more knee arthritis in our country.
But is it happening more nowadays, or it was always there?
No, it was always there, but it's being recognized more often now.
Okay.
Now, as a child, I used to see a lot of old ladies and men in the villages used to walk with crooked legs.
Yeah, the bow legs.
Yes, bow legs. And I used to always wonder why they're walking. But now, our people don't wait for that long. While they're in stage 2, 1 or 2 only, they go and visit the doctors.
So that can be corrected?
Yes. Yeah.
In stage 4 also?
Yes.
And that through surgery?
It's through surgery.
And you are known as a hip and knee specialist. So this particular thing comes into the same specialty?
Yes, yeah. That's the main area of my practice.
So with more people hitting gyms, marathons and treks, often without a proper preparation for this, what are the top 2 or 3 injuries we are seeing nowadays? With the
Now we are moving on to sports. As long as people understand that there are 4 stages in terms of severity, then I think 50% of the knowledge is done there.
Okay.
Now, when it comes to injuries in young people, Kamlksh, I think what we are seeing is more and more people are getting into the gym and they're taking a lot of these supplements, high protein diet.
Which is not good?
Which is not good. I mean, it has to be in limits, because we are seeing more of these young men and women coming with injuries and high uric acid levels.
So that protein shakes can increase your
uric acid.
Okay.
There are some people who are doing too much of this consumption of high protein, and they are bound to have this uric acid problem, and uric acid can affect the joints.
Okay.
And especially in the feet. And so that is one thing about sports. Second thing is, I think the training bit, when you're in a training session, because most in Mumbai, housing societies have their own gyms. And they also have their own trainers. Now, with due respect, I don't know where the training comes from.
I have stories to tell, because I went to the gym and I still feel that most of the trainers are not proficient enough for everyone's body.
Yes.
They can train a couple of bodies. That's what I feel.
And also, I go to gym. Sometimes I see people are being trained in front of me, and I'm being a sports medicine guy. No, that's a wrong thing. But it's not our job to interfere, because they have their own personal trainers.
Yeah.
So I think that training bit has to be looked at.
So here's my question on this. So generally I've seen trainers they have the same training for all body types.
Correct.
Isn't that wrong?
That's wrong. So in sports medicine, there's a famous bottom line. Listen to your body.
Okay.
Listen to your body, because even if your trainer says you do this, and if your body doesn't allow you to do it, please don't do it. That's
Particularly
my
as
advice.
simple as a curl also can be different.
Absolutely, absolutely. For example, I'll give you an example. If somebody has a backache, they should definitely avoid sitting and doing weights.
Okay. Big tip.
That is something that you should never do it, because you're loading your lower spine, which is already in trouble.
So standing is a better.
Standing is okay. When you're standing, your body weight goes to the spine, hips, knees, ankles, and gets distributed evenly.
So we are seeing videos on the net where you say this sitting squats, sitting curls and all are good, but it doesn't apply for each body type.
It doesn't apply. And if you have to try something new, please listen to your body, because your body will tell you, this is not for you.
So the pain is the cue for you to
Yes,
listen.
and discomfort.
But again, when it comes to people who work out, they say no pain, no gain. So how do you differentiate the pain?
Yeah, it is true. But if there is pain, there is no gain.
Yeah.
So
The pain is different.
the pain is different, and this pain actually may make things worse.
Ah.
So there is no gain.
Hmm.
So I think when it comes to exercises and in sporting injuries, it's a different way to think,
Quite a lot of people going into marathon, treks and all
Yeah,
that.
yes.
What do they need to take care
As
of?
long as you're enjoying it, it's fine. I mean, we have a lot of people. I mean, I got patients who run 25, 30 kilometers,
Okay.
and they are enjoying it. And there are some people who know what they have to do. They take regular tips from sports medicine consultants, dietitians, nutritionists, and they're very good with. They understand their exercises. That is fine. But when you are not enjoying it, and you're doing it because you have to do it, somebody is forcing you, I think that's not a good idea. And we have to be extremely careful. Let me tell you, the performance of a sportsman doesn't depend on how much you do. It depends on the way you train. Now, for example, in cricket, one cricketer can score 100, the other one can also score 100, but their training patterns are different
For their body type.
for their body type.
Okay.
This is a very different field and very interesting field, and it's becoming more and more popular. Some years ago, our elite sportsmen used to go abroad for treatment. Now they are getting treated here because we are improving, and we are also getting better and better in sports medicine treatment.
A gossip I heard recently is about, I won't like to take the name, but there are certain bowlers, their action is corrected by doing some minor surgery in their, some ligament or something. Does that happen?
I'm not aware of this.
Acha. Because this is something which I heard, ki like the action of the bowling can be corrected through some ligament or setting which is done in the body. So he gets a particular extra thing. That's what a gossip I heard from somewhere.
I know one thing, that especially bowlers, they get a lot of the shoulder issues.
Okay.
And for those issues, they may require some interventions.
Okay.
But I'm not aware of
You can change
interventions changing the
rhythm
bowling
or
style.
the style.
Yeah, I'm not
Okay.
sure about it.
This is, again, I said it's a gossip. I am not sure. So I said rather ask the expert on this.
Yeah.
From your experience, what separates a successful long-term athlete from someone who crashes early in life? Is it training, mindset, or rehab?
It is bad luck. I will tell you, I think, you can have a cricketer debut hundreds of runs, and the next thing, unfortunately, he or she may have a problem, serious injury, and they may be out of action. It has happened in the past, and it may happen in the future. But the long-term success is fitness, absolutely. But then how you have controlled fitness, I don't know. Like, for example, Kapil Dev, arguably one of the fittest cricketers we have ever had. But how he maintained his body, I don't know. But definitely everything depends on the training they receive and how the trainer understands their body.
Okay.
Yeah.
So here comes a question, I have seen a lot of parents who have put their children into football. Then they go for the topmost selections. Coming from an urban place like Mumbai or the metro cities, Now, what happens is when they go for the selection, the child who gets to play really is from somebody from a very small town or a village or something. Why does it happen? Probably that child has the advantage of running around, doing a lot of physical activity compared to a modern day child, isn't it?
Yeah.
Because a lot of people, I mean, I've had some friend who called me and said, listen, the child is playing excellent.
Yeah.
But when it comes to the main game, when it comes to the main selection, they're losing it. So this is what I
Are you
assume.
talking about the child from a rural village?
I'm talking about the child from our city.
City,
But the one who gains or probably actually gets to play the big game is somebody from the rural side. Because is it because of their physical abilities which are much more than the...
I love this question. It's the fire in the belly.
Okay.
I'll tell you, this is how... We've heard about a cricketer recently who scored 10 wickets in England. He's from a village, never had any training, I heard. So that was the fire in his belly. I mean, when you have that desire, I think you give 200%. And then there are the sophisticated, trained, athletes.
Yes.
There may be something, wrong with the training, or that desire is not, because in sports, it is always mostly, this is what I believe, fire in the belly. And I see a lot of these cricketers and footballers, especially in my practice. But along with that, you have to have other things. But it's not just fire in the belly, training. There are a lot of other issues.
There's a whole mix of things.
It's a very huge thing about then their mental status. That's very important for teenagers, especially when they go through this growth spurt. There's so many changes happening in the body, and we'll have to understand all that. So it's not just a sports physician, sports surgeon. There has to be a physiotherapist. There has to be a dietitian. There has to be a psychologist who has to. So it's a full house job.
So you recommend anybody who wants to get into the elite level of training, especially the young kids, the parents should approach like doctors like you to understand it better.
Yes, yeah. Not just me. I mean,
but you can guide them to the other stages also.
There has to be a start somewhere, and then they can guide them through the process.
Because I've seen a lot of good players today, but somewhere then they miss the bus after a while.
Correct.
Once they cross the 2021, where they lost interest because they've not been able to get to the next level.
Yeah.
And I feel being good also, there's a lot of the assisted fire in the belly is one big thing.
Yes, that is the big thing, and I think they'll never go up. They will never give up, and they will just keep trying, and one day they'll get there. And along with that, and if you have the support of other departments like especially physiotherapists and trainers, and off late, the mental health has become one big buzzword in the sporting world.
Yeah, and it is needed. You need to go to a psychologist or a psychiatrist to help you, because today there is so much of inputs coming through social media, this, and they end up being so confused.
Yeah.
So probably a child in the city is too much of info which is coming, and probably that confuses them to not
information overload.
Information
overload, and also I think because of the gadgets nowadays, either they're doing their sports or they're with their gadgets. So even that is affecting the young generation. So I think they should be out and about and do bits outside, not at the home atmosphere. So that's very important. I think I'm worried about the future, because even including us, the moment we get some time, we just open our phone and sit with the phone. And so that's not
the way it should be.
Yeah.
One question remains with the rehab part, with the sports thing. Pant had a serious accident. Now he's back into playing.
Yes.
How does this work? I mean, today, probably 20 years back, this would have been a very difficult phase for him to come back.
Yeah.
So there's a lot of improvement which has happened, and every day you all are adding new ideas, new technology, some new medicines and things like that, right, doctor?
We should all appreciate him, because he has also done excellent job, and I think he was really working hard post injury. But then, when something like that happens, there are two types of injuries. There is a type of injury which may heal faster. There's a type of injury which may take longer time. For example, if somebody has multiple fractures in an accident, and those fractures may take much longer time to heal. And if there are other injuries, they may heal quicker. But then again, depends on each individual, their own healing potential. Some people heal faster. It's well known, and in some people the healing process is very, very
Slow.
Very, very slow. But he has made a very good progress. Obviously,
So that is individual, you say.
Correct, yeah.
It can't be with everybody. So, but
obviously he's received some good treatment and good advice, and he's trained very well and his rehabilitation was excellent.
And a lot of sports people come to you also for rehabilitation.
I am not a rehabilitation specialist.
But they might be approaching you to.
Yes, but then we have a team. We, in fact, in Hirandani Hospital, we have sports medicine, sports physiotherapist
Okay.
who looks after sports injuries and also sports surgery rehabilitation patients.
Okay.
So it's a team effort.
Okay.
The sports surgeon like me does the operations. Obviously, then the post-surgery rehabilitation happens with them.
Okay.
But it's under supervision. So it's not like we finish the surgery and forget them. No, until complete recovery, we follow them up.
So it's a team which takes the sportsman back into action.
Yes, that's right.
You introduced PRP in India in 2009.
Yes.
Where does PRP therapy stand today for sports injuries? Real healing or is it just a promise?
It's a very nice question. But, PRP is platelet-rich plasma.
Yeah.
And the logic is that we have growth factors in our blood, in our platelets. Platelet is part of blood. Okay. The logic is that some things are not healing, and we take healing potential or healing power from our own blood, inject them. That was the original idea of PRP. Now, how this started, one of the Bollywood actors had a knee injury. He went to Stanford University in the States, and it was in the news here that he is recovered and knee ligament is all healed and everything. And that was on the front page. And I had just returned from England at that time.
Okay.
And my wife pointed out to me that, there's an article here on PRP. So I wrote to the gentleman who actually injected to this guy, this Bollywood actor.
Okay.
Okay. And his name is Alan Mishra. He's a very popular PRP man in the States. So I wrote to him and he said, Vijay, why don't you come over? So I went there was a conference in Las Vegas, American Academy. So he took me there and I spent 3 days. The technique is not technical. It is a simple injection. But the logic behind PRP. So I was really interested and I came back and I had to go through, ethical committee approval and all that in Hirandani Hospital. All that was done. Then I started PRP and my first patient was my inspiration. That was the plantar fasciitis patient. She was our secretary. And I said to her, look, there is no harm. It's a very safe procedure. And if you've been, struggling for months together, if you're okay, I'll do the injection. We took their consent and all that. And she was good in 3 months. So that's where my journey started.
So you almost pioneered that.
Almost here. In our country, I never heard anybody was doing. There may be people doing, but it never came into light. So I then I thought this requires research because anything that you do, as long as it's safe to your patients, it's fine. But then whether it works, not just safe, then we had to I became a member of International Society, and then I became part of the research committees on PRP. And now there are so many publications on PRP. And the latest, I can tell you, there are some conditions like tennis elbow, which is a sporting thing. And then plantar fasciitis, which is the foot problem, and some ligaments. And there is, in terms of hierarchy of evidence in research, you have level 1 and level 5. Level 1 is like best.
Okay.
If that is saying that PRP works, it works.
Okay.
Level 5 is an expert opinion.
Okay.
In between, you have other levels. So expert opinion is like with your experience, you're saying, okay, in my experience, this has worked. But whereas level 1 evidence means you can quote that everywhere and say, this article says that it works. That's why I'm doing this.
Okay.
So I can confidently tell you that there are some conditions, especially sports, are doing so well, and we have several level 1 evidence. I do lectures on PRP, every conference I go.
So it's
almost.
highly recommended.
Highly recommended in some select conditions.
Okay.
Not everywhere, yeah.
So you have set records for fast recovery post knee replacement.
Yes.
What's changed in the surgical and rehab ecosystem that makes this speed possible today?
I think I had a lot of time then. The first time when I came from England, I was just sitting in my cabin doing papers and just as and when patients came, I was operating. So this first patient was the mother of my first patient of the record.
Okay.
Limca book of record. Mother of my friend who is an orthopedic surgeon. He requested me that he was not here in India, so would you mind doing her knee? So in a day, I used to see her like 5-6 times because I had time. I operated and she was perfect, no pain, and I was in sync with the anesthetist. I was in sync with the physiotherapist. And the second day, which is within 48 hours, she said, I want to go home.
Okay.
So it didn't happen just like that. She went home. I forgot about the case. I said, hey, it's quite nice. Then I was in a British journal review meeting in London. And so I spoke to the editor and I said, is there any evidence or any publication which tells us about 48-hour discharge post total knee replacement? I casually asked him. This was probably a few weeks after I operated. So lunchtime meeting, he said, come here. Vijay, come here. So I spoke to him. His name was James Scott. He's now retired. So he said, I don't think there is any paper that says 48 hours discharge post-surgery. So I came back. Then we were discussing at home, my wife and me. And then she said, why don't you write to this Limca if they have any other this thing? So I wrote to them.
Okay.
So I just wrote to them and I wrote an email saying this. And then they said, we want to see the evidence. So I asked the chief editor, can you give me in writing? Can you send me a message saying, that writing? They said, yes, we are not finding anything. So that's how it became.
That's when it came in the records.
Yes, yeah.
So
that's the story.
What I understand from what you've been telling me, your wife has been a guiding force and an inspiration also. She's given you a lot of tips on what to do.
Mostly, yeah.
That's nice. You're researched on robotic-assisted TKR extensively. Where do robotics shine today? And when does the human hand still reign supreme? The robotics are there, the machine to AI happening and all that, but your hand is the magic hand.
Human hands are still supreme.
It will always remain
man behind the machine is very important. I'll tell you why, because there might be some debate about this, but the reality is the robots help us to measure the alignments, help us to make, you asked me one question whether the bent knees will be straight. So yes, they'll be straight, and those angles that we have, robots give us the precise measurement.
Okay.
That is the main advantage of robots. Otherwise, traditionally what we do is we take a long leg x-rays and then we measure and then we correct it on table.
The robot will give the detailed explanation.
This thing. And that is one advantage of robot. Second thing is when you're doing surgery, especially knee replacement, we'll have to do the cuts, bone cuts. And also it advises which way to do all that. Because there is a robot arm which will just take you through. The final implantation of the implant, by this what I mean is after you do all the cuts, then you will do the implants finally with cement. That is done by the surgeon. By then we remove the robot from the operating table, and that is done by the surgeon. Now this is a very important step. Now for example, if you have to fix something like that here, if your hand goes that way, it's fine. If it slightly tilts a little bit, you have changed the angle. So the man behind the machine is so important. The second thing is I don't recommend robot to. This is my advice and my opinion. People may change their opinions based on their experiences, but if I personally feel that a young budding surgeon should learn a conventional knee properly and then move on to robot if they want to.
So
Because if there is a problem on table, he or she should know how to deal with it.
everybody's physiology is different.
Different.
So as you said, when you placing the knee, the angle is so important.
So important.
How is that, and how do you all know that?
See,
That's with experience.
that is with experience.
So
Nothing can
Doctor,
be an
you also-
alternative for experience.
Doctor, you also said about the same day, like how you went into the records. and
Yeah.
this. At this present time, is it happening with everybody, or it is
Now things have changed. I mean, now people are actually doing, discharging patients at 48 hours, 72 hours. That's because the technology has changed. The pain management, mainly in surgeries like knee replacement, it is post-operative pain. If you are able to manage the pain effectively, the person can go home. The reason why they stay in the hospital is basically pain management after second day. So, and that has changed, and there's so much advance. The technology in pain management has also changed. Now patients can control their own pain with their own devices.
What do you mean by devices?
They will have a button, in hand. It's called epidural anesthesia, where the moment there is pain, they can just press, and that will release the medicine into the body.
So they already
There'll be a tube attached to the spine.
till a certain point of time, or it is for
No, this
severe
happens for
cases?
until 3-4 days.
Okay.
But then even pain management post discharge also is a very different ball game now. So that's the reason why nowadays going home at 48 hours, 72 hours is not a new thing.
So it's a common thing which is there, and it applies.
It applies, yes.
So something very exciting I know about your test, which is called the Shetty Test. I love that thing. A diagnostic method which you have without radiation, which you have started.
Yeah.
What inspired this? And
This is
how close is it to the mainstream one?
when I came back from Cambridge, from the UK, I was on my own.
Mm-hmm.
I was the boss, which was a good thing of my practice. But at the same time, there was huge pressure on my shoulders because you're a surgeon and you're independent. You're in a new place because I'm not originally from Mumbai. I hardly spoke, forget Marathi. With due respect, now I speak even Hindi. So I was always thinking that practice is practical. When somebody comes in to you with a limping leg, you don't have to be a doctor. You know there is something wrong.
Right.
When someone comes to you walking, but slight pain, you know there's nothing major. This was hitting me all the time, and especially with children. And ankle injuries, if you see, that is the commonest sporting injury. 15% of all sporting injuries
It's an ankle.
is an ankle. 15%, 15 out of 100, which is a big, huge number. So, and most ankle injuries end up with X-rays. You go and see a doctor, you send them for X-rays. That is a standard teaching. I mean, you have to do it. If you don't do it, and if you miss a fracture, it becomes a legal battle. So what I was doing at that time, especially when children used to come, it's difficult to examine children. So I used to make them sit on a couch with the leg by the side, and I used to tell them, you rest your foot on my hand. I won't do anything. Keep pressing.
Push your leg.
It's a simple logic, because I'm not doing anything. If I come and mess with your foot, you'll start screaming. So I used to tell them, just rest your foot on my hand, push hard, and they would do it. And then for completion, I used to send them for X-rays, because parents would get anxious otherwise. Doctor has not even done the X-ray. So, and then I realized that those who were sitting, pressing hard, were not having any fracture post X-ray.
Okay.
This was my observation. And I observed that those who were really pressing hard, they never had any fracture or any bony injury. Soft tissue injury can happen. So I started researching. So I set up a study, which was a prospective study, where we did two groups. One group, by then I didn't know what test was that, who were pressing hard, did the X-ray. Other one who were pressing hard but in pain. We did the X-ray. This group had fractures, 95. This group had no fractures at all.
Okay. So that was the Shetty test.
So I said, now we have to get a statistician because I have to publish it. Otherwise, nobody will know. I can't just say this is my test and just you start in your practice. We have to publish it, and I had to publish it in an international journal.
Okay.
I wanted it to appear in an international journal, so I hired a statistician from Tata Institute.
Okay.
And he was a very senior statistician. And he said, this is the model of our research and this is what we need to do. We came across so many things, so many numbers. Kamlksh, you won't believe this. What we found out was we were saving 40 minutes on each patient. We were saving about 1,000 rupees on each patient. And we were saving them from radiation.
So that was an innovation.
Today
it's recommended?
Yes. We published in European Journal of Orthopedic Surgery. Within 2 years, a major trauma center from Spain, you can Google Shetty Test, from Spain, they revalidated. They said, we don't now need to do X-rays in all ankle injuries, only select few. And just about 2 or 3 years ago, a major trauma center from Australia has taken it on board. So even they are not doing the tests. The major part is, the amount of time and money that you save, and you're not exposing children for radiation. So I do it all the time in my practice. In fact, there's a Bunt doctors meeting in the next 2 weeks. I'm going to talk about it.
Lovely. That makes me so proud.
Thank you.
Shetty test.
It's a very, very, very simple test, but there's so much logic in it.
So you keep innovating in all what you're doing still now. That is so amazing, doctor.
This is just, I think, if you keep your ears and eyes open in your practice, there are many things which tell the stories themselves. We don't have to really go into rocket science.
Years, I understand you got very intuitive also about a lot of things. You understand, as you said, the patient walking in, all that's had been created. I think it's just practice and is added to what you're doing. So with global implants right now, versus the local options we have, are we prioritizing or price over proven outcomes? How do you balance cost and care today?
Yeah.
Because you said this helped 1,000 rupees earlier.
Yes.
So you also are a doctor, I know, who always have been very clear about them. You won't recommend things which is not necessary. So what do you have to say about global versus Indian options?
I did an interview for ET some time back.
Okay.
The same question was asked to me by a senior journalist. I don't have any problem with Indian implants. They're good quality, all that.
Okay.
The only problem is the backup research evidence. We don't have so much of research going behind them. And cost-wise, they're much cheaper. And the quality-wise, I don't see any problem.
Okay.
But then the natural instinct is, I don't know why this is happening, but most people, ask for imported implants, the so-called imported implants.
Because we still are not confident as a country on this, or research is needed.
We just need to publish papers on them. The lack of research, that's a problem. Otherwise, we have fantastic, implants here and doing the same job, and maybe 1/3 the cost.
We have doctors like you with international way of thinking and the way you have approached things, right from going into research and putting things into order. India is becoming a medical tourism hub today. Are we ready, orthopedic wise, for global clinical standards today?
We were ready 100 years ago. I'll tell you, because even today, the best of best doctors you see in the Western world are from Indian origin.
I agree. Absolutely agree.
I've traveled quite a lot. I see a lot of, I go to these international meetings. I was talking to you about being an examiner in an international organization. So we come across so many people. The medical tourism in India, if you ask me, it should have started long back. The type of institutions, the hospitals that we have in our country, they are top range. I can tell you, the hospital that I work today is probably one of the best in the country I've seen. I was out of the hospital for 4 years as a visiting. I did some work elsewhere, but the infrastructure that we have, the type of support that we have, the backup, and especially the post-operative care, all that is excellent. So it makes a lot of sense because medical, somehow, the tourism work, the tourism, that letter is not that attractive. I think we should change it.
We should change it. We should coin a word differently.
Yeah.
You are an inspiration for a lot of young people, young doctors coming. What is the biggest mindset gap which is there between your time, people who have worked hard and come where you are, to the present day doctors? What is the kind of thought process they should get into?
So I keep telling my students this. See, there is nothing like competition in this world. If you go behind competition, I think that is the biggest disaster. And I have never been. And I used to just sit and think that this is what I need to do. And I need to make sure, especially in my field, that I don't want to be, casual. When a patient comes to me, he or she is coming with a lot of trust.
Absolutely.
So we can't be casual, we have to focus on them for that 15-20 minutes and understand them, understand the personality of the patient, and then try and get to the bottom of the story. If you can't, then you may have to go for some investigation, all that. So this is what we need in the younger generation. They should not be casual. Medicine is not about being casual. Medicine is a serious stuff. You have to respect that person in front of you, listen to them carefully, understand their problem. Sometimes it may not be connected to you, and then you get opinions. And these are the things. We don't ever think that I know everything. That's a wrong thing. And also now this day and age we have help available. Don't make a patient just keep coming to you and not get to the bottom of the story. If you can't, okay, accept it, and then get help from somewhere else. This is what I want to tell my students and this generation surgeons.
That's the right way to put it.
Yeah.
Today's generation also is very Google research, and they
do ChatGPT, come with the diagnosis.
What do you have to say about that?
No, it's complete waste of time. Complete waste of time. And also these days, it's very interesting. People write letters through ChatGPT, and I get patients with 50-60 pages of documents coming with information on their condition and expecting me to read.
And they get it from ChatGPT.
ChatGPT. This is happening on a daily basis. So it's a wrong thing. Why it's a wrong thing? Because you are picking up something which is already written. You're not thinking. So now we spoke about research. Now I get this lot of papers for review, international publications. They send it to me for my opinion. There are many articles that I've seen that I can see that this was taken from ChatGPT, seeing the language.
Yes.
So it is bad for research. It's bad for our practice. You can take help for something. Okay, you're going on a holiday. Look at even that is also not right, because I was going abroad 2 months back. I just thought, okay, let me see. I was in Berlin in 3 days in Berlin. What to do? Though they recommended some hotels, same hotels, and same places to visit. All that. So this is all. I don't think it's the right thing to do.
The practicality is more important. Here, I want to ask, going back to the sports injuries, what is the worst injury have you seen, and how did you treat it?
Whether I treated or not, I don't know. But the person went back to sports.
Okay.
And this was a hip injury.
Okay.
He was playing cricket, and hip is a ball and socket joint, and he cracked the ball
just by action.
He was in cricket. I think he was batting, and so there was a loose body, the fractured fragment. Now the problem is whenever there is an injury in the ball of hip joint, there is a risk of what is called avascular necrosis. Means the head dies off, the ball dies, the blood circulation stops.
Okay.
Yeah, and that's a major injury. And in a cricketer, it's a big thing.
Okay.
But we somehow managed him. He went back to cricket, but not at the same level. So that was the worst injury of a sporting injury in my career so far.
So it needed some surgery for that?
No, we had to take that fragment of the broken bone. Then we had to use what is called hyperbaric oxygen, where you put them in an oxygen chamber to improve the oxygen level in the head. He was pain-free, but didn't go back to the same level of sports that he was doing before.
A few more questions.
There is one more thing, if I may add.
Please.
You touched on PRP. The interesting injury that I had was one of the IPL players was brought to me by his physiotherapist, bowler. Okay, he had pain in his thumb.
Okay.
And it's very important for a bowler. And he was specifically sent to me for PRP because we brought it up. And I did PRP injection here in Hirandani Hospital. And then I spoke to the physiotherapist 3 months later. He said he's back in the game. He's been taken by Gujarat Titans. So I said, oh, very good. That is a happy thing.
Why do you believe education, not just surgery, is the missing piece in modern orthopedics?
Why do I believe?
Education is necessary, not just the surgery. You need to know the wholesome part about
Correct.
what is there to be done.
Thank you for asking this question, because this is, I think, very relevant in the modern time. Because me as a surgeon, especially when I started on my own, I never used to sleep previous night. I used to try and get as much information as possible about the patient, about my steps of surgery, and about what might go wrong. This is the most important part. What might go wrong? If I have that information in my mind, every step that I take during surgery, I'll be careful. And then what I did, where comes the education. Every surgery day, I even now I do it. I call I call them fellows, because they get a fellowship award at the end of 1 year after working with me. And 15 minutes before, I ask them to give me all the steps.
Okay.
So that they read and come. So that becomes a big win-win situation for both of us, because me as an operating surgeon, my fellows read about it, and we know exactly what we are doing. It's not like, oh, we start this, or what's the next step? No. So there comes the education. So my way of teaching them is just tell me what can go wrong by this step. What can go wrong by this step?
And you're still learning on those things.
Yes. And I love it, because they also come up with some good ideas, because these people come from some great institutions like Sion Hospital in Mumbai, KEM. They would have seen more cases than us. And they would have seen some excellent surgeons operating under extreme circumstances. We are blessed with a good setup, but there are people who are working under extreme circumstances with excellent techniques. And I get to see that with some students who join me. And they tell me, I take it on board immediately.
And are they around you during surgery sometimes?
Yeah. No, always.
Always. Okay.
Always,
You get
always.
them around.
Yeah.
Thank you, doctor. This is wonderful. I'll have some quick questions.
Please go ahead.
What is one supplement you personally swear by for bone health?
2 supplements.
Okay.
Vitamin D3
Okay.
and B12.
So, but vitamin D3, is it safe to have it regularly?
Yes, I will tell you the logic behind it. I think this is a very important information for the general public. Now, most people are on supplements. They are on supplements on their own, self-medication.
Right.
Which is bad. Okay. Now, in the Western world, they call that drug holiday. You have to be taking vitamins regularly, but not on a daily basis, not constantly. So you take it for 3 months, ideally, and 3 months break. Okay. Now, answer to your question: if there are too much, if there is too much vitamin in the body, it can be toxic. So what we do is you take 3 months of vitamin D3 and B12 and take 3 months off. Then now there are 2 schools of thoughts when to restart. Okay. Because we know in our country especially, it will go down at some point. It will go down. I said 90%. So when to restart? One school of thoughts says that you have to do a blood test 3 months and you stop it for 3 months, then do a blood test and restart the vitamins again. The other school says simply listen to warning sign.
What are those?
Pain, I told you earlier. Pain, unexplained, and pain in a otherwise healthy individual. Suddenly beginning to pain. That is vitamin D, mostly, 90%. So that is when you restart. And once you restart, again, take 3 months and take a break. So that is the right way of doing. Either you can follow school number 1 or you can follow school number 2. Now, school number 1, you end up spending few thousands of rupees for tests. School number 2, what happens if it's normal? No, you have not taken for 3 months. So it can't be in toxic level.
Okay.
Got it?
Yeah, got it. So is it okay to have, for a healthy individual also to have this supplements?
I recommend it.
Okay.
Yeah.
From what age?
Yeah. I think once you're in 40s and 50s, you should start.
You should start taking it. Surgery or rehabilitation, what's harder to get right?
In my opinion, it's rehabilitation. It's because I might do the best surgery possible. Technically, very sound operation. But if rehabilitation post-surgery is not great, everything might fail. For me, that is important. Why that is important for me? Because surgery is my forte. And I look at the patient and I make sure that everything goes fine. And rehabilitation, I'm not there. Someone else is doing it. And
the person has to follow also.
So that is the challenge, especially in sports. Now you see, Rishabh Pant, you asked me, rehabilitation in his case was excellent. But the surgeon has done a good job. The combination is outstanding. See, you've seen the results.
And his accident was also out of sport. I mean, it was not in the sporting
thing. Yeah, but he's a sportsman.
So that was wonderful. I mean, I take this as a case to get inspired also.
Correct.
So that person's own resilience also helped him.
The most important bit is mental health. He should be strong. He should not say, "Oh, I was playing cricket for the country until yesterday. Am I going to play again?" If that hits you, again, it's a big problem, big challenge. I think he never let it happen.
People are running, people are lifting weights, people are doing a lot of exercise thanks to social media. And my times, it was a Rambo movie which would inspire me, or the Rocky would inspire me.
Correct.
But today, I think social media has a lot of fitness people, freaks who are there. One common mistake fit people make about their joints today?
I think they don't listen to their
body.
That is the biggest thing. And also, some exercises may not be right for some joints. It's difficult to say. It's a big topic. But for example, if someone has a knee issue, if you see any gym, if you go, you see the commonest exercises that you see is squatting and lunges.
Yeah.
Okay. Very common, and most trainers love it, and they like that posture of the trainee and the way they get their results. But if you have a knee issue, they are going to make it worse.
Yeah.
Yes. This is the answer to your question. So that if you have a knee problem, the lunges and squats are not so great for the knees.
Coming back to it, that means you need to listen to your body. Your trainer might not know your body.
Might not know. They won't know.
Yes.
They won't know. Now see, there are many trainers. There are celebrity trainers nowadays. And for them, their training is the most important bit, because the moment you see a star's trainer, you go, rest of them go behind them. So it's a huge business as well. And their aim is to produce results.
Absolutely.
In the event,
in the short period of time.
In the event, they may forget some basic principles.
Pain is the key for people to understand. If your joints could speak, what would the knees say after 40?
I'm tired. So the joint would say, I'm saying, not me, I'm not tired. So but the thing is, it depends on a lot of other factors. The hereditary factors are very, very important. Now, from our background, you would see we are from coastal area. Seafood. Our bones are very strong. Okay. But having said that, even arthritis is common in that part of the
What is the reason
world.
for it?
It's probably because of the lifestyle.
The present lifestyle or
The old, I mean,
lifestyle?
we most of us sit on the floor,
Mm,
all that. So I think um, if someone's family member or mummy or daddy had an osteoarthritic knee, there is a good chance that son or daughter can have osteoarthritis at an early age. Why this information is important? Because we spoke about progression, stage 1 to stage 4. In some families, this progression may take years together. So even in 90s, you might be just in stage 2.
ah,
So in some families, the progression may be so fast. In 50s, you may show degeneration, stage 4. So me as a knee specialist, I see osteoarthritis in people in 40s and 50s and also in 80s and 90s. So then you go back to this hereditary thing.
so much of information in one day. Thank you so much, doctor.
Thank you.
Any last point would you like to say, please?
Two things I want to say. This is for our patients. And thank you for inviting me for this one.
Pleasure.
Through your channel, I think you've done a great job and congratulations. The second thing, the advice from me, as anybody's doctor, listen to your body in sports medicine, and in general conditions, listen to the warning signs.
Okay.
That's it. When it's warning sign, start vitamins. When it's listening to your body, it's for this sporting injuries, to avoid sporting injuries, in the gym especially.
Yeah, I think that should go with a lot of the young people who are just hitting the gym without knowing themselves well.
Yeah. And also in training, there are stepwise training. Don't ever, if there's been an injury, okay, 3 months over, things have healed, let me go and play cricket tomorrow. No. We have to start stepwise rehabilitation. Speed walking. I mean, walking, speed walking, then jogging. If that's good, body tells okay, then running. Once you're good to go running, then you're ready for the game.
Wow. Thank you so much, doctor. It's been
Thank
a
you.
wonderful day. I've added so much value to this day and it's going to
Thank you.
add a lot of value to people. Thank you.
Thank you.
That was Dr. Vijay Shetty. And believe me, I got emotional through his journey. Orthopedic care isn't just about surgery, it's about education, prevention, and trust. Thank you, Dr. Vijay Shetty, for being with us. If you found value in this conversation, don't forget to like, share, and subscribe to Who's on Air. Until next time, stay curious, stay healthy, and keep moving forward.